By the 1930s, it was clear that anaesthetics were getting more and more sophisticated. But the people in charge of giving them weren't. Before professional associations existed, anyone in the operating theatre was allowed to control the flow of chemicals to a patient. As one professor put it, anaesthetists are at the bottom of the professional hierarchy, with a high proportion of dimwits, no-hopers and drunks. Something had to be done.
There were undoubtedly calamities that took place because anaesthesia wasn't of a high standard or of the same high standard across the country.
So the so-called dimwits, no-hopers and drunks got together and decided to set exams for their profession and established the Association of Anaesthetists of Great Britain and Ireland. They needed to do it, they said, because of all the developments in their specialty. One of the most scary was intubation, putting a tube down the patient's throat so a machine could make them breathe while they were unconscious. If the anaesthetist put the tube into the gullet instead of the windpipe, it could kill the patient. Other developments kept anaesthetists on their toes. New ways of knocking people out, monitoring them while they were out, bringing them back and keeping their bodies functioning. It put massive responsibilities on the knockout doctors, who spend their day taking patients as close to death as possible.
When you're dealing with somebody's life being held in your hand, then you have to concentrate every second on what's going on. You have to watch every heartbeat, you have to watch every breath, balancing the drugs that are being given, the pain relief, the sedation, the muscle relaxants, getting everything just right, taking over the normal functions of the patient, keeping them safe, and then bringing them back again afterwards.
Other drugs emerged with new properties. Halothane could knock you out in 2 minutes, rather than the usual 5 to 10. New ways of administering anaesthetics were also discovered. One of the most significant was demonstrated in the dunked dog experiment.
This extraordinary picture shows a dog upside down in a tank of water under an anaesthetic. And what is demonstrated was that you can have truly closed-circuit anaesthesia with a cuff inflated. Not even being underwater would allow anything to pass down into the lungs of the animal or the patient unless it was delivered through that anaesthetic delivery system.